Hi, my name is Evelyn Torres. Today is October 11th, 2022. Here is my sign, Evelyn Torres, October 11th. So for the case studies, the first case study connection I picked was case 2, which is about a 16-year-old girl. She was recently diagnosed with a deficiency of muscle glycogen phosphorylase. She and her family have a couple of questions and have to follow up um, based on what I know about skeletal muscle glycanolysis and muscle metabolism. So the first question that the 16-year-old girl asked is, I'm not sure I understand the issue. Can you explain how muscle glycogen is used normally during exercise? So my response was, well, muscle glycogen is like fuel for your muscles in the body. Um, During exercise, glycogenolysis is a metabolic pathway where glycogen is broken down into glucose 1-phosphate, and the glucose is which is like energy for your body. During that process in the pathway, there is an enzyme known as glycogen phosphorylase that removes single glucose residues from linkage to make the glucose 1-phosphate. So when the muscles do not get their energy from the glycolysis, then the person will start to experience muscle weakness or stiffness that can be very painful. When there is a deficiency of the muscle glycogen phosphorylase, it is known as McArdle disease, which is a mutation in the genes. So if the phosphorylase cannot do its job, then the muscles aren't getting enough fuel. Her second question was, I really like to take long walks. Will I still be able to do this with my friends? Um, Exercises can trigger symptoms with patients that have McArdle disease, which is also known as MD for short. Um, like they will experience muscle weakness, stiffness, which is from the imbalance between the muscle energy. However, supervised exercise can help to reduce symptoms that correspond with 60 to 70% of maximal heart rate. So you can take walks with your friends, but I would recommend to start low, then slowly go to moderate exercise. Walking or cycling for 10 to 60 minutes with the intensity of 60% max heart rate about 5 times a week does help oxygen uptake. Also, eating carbs before any exercises can help as well with the symptoms. Her third question was, as a result of this deficiency, will I need to get up at night to eat to maintain my blood glucose? Well, there's two places where glycogen is stored, which is the liver and skeletal muscle. Liver glycogen allows the liver to acknowledge to low glucose levels and release its stored glucose into the blood. Meanwhile, in the skeletal muscle, glycogen lets the tissue to respond to aerobic metabolism by releasing glucose. So it's not really necessary for you to get up at night to eat in order to maintain your glucose level, since this deficiency is in the skeletal muscle and not in the liver. Muscle glycogen is never really used to help glucose. And her final question was, do I need to worry about producing excessive lactate during intense anaerobic exercise? No, you do not have to worry about producing excess lactate during intense exercise. The blood lactate falls with patients with McArdle disease during exercise instead of its normal rise that would be generally seen. The lactate levels in patients with McArdle disease are low during exercise and after exercise as well. The next case study that I chose was case 4. The little background is a previously healthy 2-month-old female presents with jittery spells several hours after breastfeeding. Her mother reports she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours between feedings, and that's when the mother reports these symptoms started. The laboratory results are consistent with hypoglycemia, which is low blood glucose, but otherwise unremarkable. Epinephrine is administered and there is no increase in blood glucose, but there is an increase in blood lactate. The physical exam reveals the liver edge 4 centimeters below the right costal margin. Percussion of the right chest and abdomen confirms hepatology which is enlarged liver. Blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within the normal range during fasting. So, for the 4 answers were heredity, fructose intolerance, galactosemia, glycogen shortage disease, and glucose 6-phosphate dehydrogenase. So answer A, for heredity, fructose intolerance symptoms are very severe vomiting and hypoglycemia. It can also lead to poor feedings and jaundice after consuming fructose or sucrose. Fructose intolerance is when there is an absence of aldolase B, which cleaves fructose 1-phosphate. According to the description, the baby has been healthy for the past 2 months, and the breast milk is primarily composed of lactose, which is glucose, and galactose. From the lab results, the baby is not showing any issues with the liver values that can be jaundice, only hypoglycemia. The baby is also not showing any vomiting symptoms, so answer A cannot be the diagnosis for the patients. Answer B, which is galactosemia. Galactosemia is a very serious disease which is caused by galactose 1-phosphate uridyl-transferase deficiency. With galactosemia, infants are not able to metabolize galactose 1-phosphate and result in the injury to the liver, brain, and the kidneys. After the first feeding, babies can show symptoms of vomiting, diarrhea, hypotonia, and jaundice. Since the symptoms are present after the first feeding and the baby has been healthy for the past 2 months, option B cannot be the correct answer. The patient isn't showing any of the symptoms that correlate with galactosemia. Okay. Answer D, which is glucose 6-phosphate dehydrogenase deficiency, is when there is no generating of the NADPH in the pentose phosphate pathway. Its role is to protect red blood cells from oxidative damage. Some symptoms from glucose 6-phosphate dehydrogenase deficiency is fever, dark urine, pale skin, and fatigue. According to the patient's results, the patient is not presenting any of these symptoms and no infections are shown in the laboratory results, so answer D cannot be the correct answer. So that leaves us with answer C, which is glycogen shortage disease, which is also known as GSD, is when there is an abnormal type or quantity of glycogen in the tissues, and it changes the way the baby uses and stores glycogen. Patients with GSD can experience low blood sugar, which is hypoglycemia, which the baby it is presenting, enlarged liver, and high lactate levels. The baby is showing an enlarged liver, and when epinephrine is administered, the glucose is not going down, but lactate is going up. Babies will start showing these symptoms around 3 to 4 months and will have severe hypoglycemia from fasting intolerance. The baby is around 2 months, so she's almost 3 months, so kind of around the the age. Um, and from what mom says, when she's not feeding the baby for 2 hours between feedings, she does showing hypoglycemia. When epinephrine is used, it causes little or no increase in blood glucose, but will increase lactate concentrations. This also is called an epinephrine challenge test. This patient does not show, this patient does show enlarged liver, and lab results also show the patient with hypoglycemia. The patient is also around 2 to 3 months, which is with the symptoms start to show. She was also given epinephrine, and it was observed that her blood glucose did not increase, just her blood lactate. So answer C is the correct answer, and the most likely diagnosis is the glycogen shortage disease.